afternoon, everyone, and welcome to the session Leadership that Inspires Action, Transforming Healthcare Together. In this session, we will be exploring what enables teams and individuals to act and how leadership can remove barriers to accelerate progress towards sustainable healthcare. Attendees will leave with actionable ideas to implement in their own institutions. Before introducing our great speakers today, just a couple of points from me. Please note that this session is being recorded and will be available on this page shortly after the session has ended. Please use the live chat in the panel to the right of your screen to add any comments or the Q&A tab. You can send questions to our speakers, which we will take later on in the session. Please specify who your question is for, and we will aim to ask them to the speakers later on. If we do not have time to answer any questions or all the questions, then speakers are encouraged to answer them after the session in the chat. Otherwise, please feel free to engage directly with any speakers or fellow attendees via their profiles, and we even encourage that. So today we have with us three incredible speakers who will share their experiences as leaders in different organizations. And I would now like to introduce our first speaker, Alexander Tomasa, who is the head of administration and services at CABEC HaDEA in Austria. His work focuses on organizational and workforce development, cross-developmental programs, and governance. He's one of two federal coordinators of the Austrian Association of Green Hospitals and a member of HCWH Green Team. Also, since 2025, he serves on the Executive Members Committee of Healthcare Without Harm Europe as a representative for CABEC HCWH. Alexander, we are very happy to have you here with us today. Please, the floor is yours.
Thank you very much for the invitation and the opportunity to talk about what we do in our hospital. On the screen, you should see our hospital. It's Regional Hospital Villach. We have about 650 beds, 2,000 employees, and about 100,000 patients each year. We've been EMA certified since 2009. And our latest carbon footprint numbers show that we've reduced scope 1 and scope 2 so much that now scope 3, like all the goods and services, etc., transport, make up 93% of our carbon footprint. So I think we are on the right track. We have also been leaders in Austria. So like we were the first hospital in Austria to recycle volatile anesthetics, and we are capturing them in the operating theater, and they are being recycled. And both the filter, like it's on active carbon, both the filter and the product can be reused after the recycling step. Another thing we did, that's what we did, we began with it about 1.5 years ago, is introduce the planetary health diet. We were also the first hospital in Austria to do that. Planetary health diet is a concept that's been published in the Lancet. It's a concept by the Eat Lancet Commission. And it focuses more on vegetable protein rather than animal protein. What helped us is that the Austrian food pyramid has been updated recently, like in 2025, and basically conforms to the planetary health diet. So if you like, in a practical way, it's like 1 portion of fish, 1 portion of meat, and 1 portion of fish or meat each week. So like that's the most important thing, I think, to say about that. We were also co-founders of the Austrian Green Hospitals Association, Österreichischer Verband Grüner Krankenhäuser, and that was helping us, that helped a lot with the networking within Austria. We also give out, the Green Hospital Association also gives out awards, a good way to collect best practices, to connect people. Yeah, and that was the award ceremony in 2025. We already gave the awards out in 2026, but the picture of 2025 looked better, so I chose that one. What we are also currently doing is trying, since our scope 1 and scope 2 numbers are so low, we are also trying to reduce our general carbon footprint by reducing unnecessary tests. So, for example, in our surgical daycare clinic, if you're young and healthy, we won't give you any blood tests if you have a small operation done there. Another thing that we're doing that's not saving CO2, but that's helping us with our resilience is we reactivated our own spring. We are now independent of the water supply in our city. We prioritized this after in a neighboring city the water supply was contaminated for a few days, and the other big hospital there fortunately had their own spring, so we reactivated ours, and I think that's very important. Another thing that we're very proud of, because it's a once-in-a-lifetime opportunity, is we're part of a city district rebuilding. We are in the city of Villach, close to Italy and Slovenia, 60,000 inhabitants approximately, and one of the districts is going to be the Climate and Health District. It's the district our hospital is in. So I don't know if I can show you, this is our hospital grounds. And all this is the district, and this is going to become the Climate and Health District. And we've been very, very active in shaping this. The first part of the project is going to be this small part that's going to be rebuilt. And as you can see, it should be a very green and open way of living. We want not only doctors there, etc., but we also want intergenerational living and so on. That should be there. So now to our approach, that were our projects. How do we do this? Or what do we think is important? We started where change is possible and easy. There are so many low-hanging fruits where you can save money, have health co-benefits, etc. And if you just do a pilot, it's a good thing, and you can create momentum that way. What we also find very important is to change defaults, like the routines and the ordering systems need to be changed. So, for example, when we implemented the planetary health diet, we also changed it so that the vegetarian menu is the menu 1. So if nobody changes anything, the patient gets the vegetarian menu. And with the standard operating procedures, if you if you give out documents that say this is how we do things, it's just gonna facilitate adoption of the measures. Another important thing for us is that you need to communicate what matters. If measures have health benefits, if they save some money, if they improve resilience, both of employees or of your organization, it's much harder to say no to implement them. So that's why we are going that way. In Austria, the largest political party does not believe in man-made climate change, or at least it doesn't believe that any measures we take in Austria can change it in any meaningful form. But that way, with co-benefits, we can get around this problem. Another big thing is find partners. We made our own network. We joined Healthcare Without Harm, and even if you're in the organization, find partners. We made a green team. I'm going to show a slide later on, or the next slide actually, what the green team we have consists of. Also here, work across professions, include everybody. So if we didn't have, for example, the doctors on board or the dietitians on board with the planetary health diet, the project would have been stopped before it even started. So also hygiene staff, etc. So a lot of the time you just need to work across professions and really give them the feeling that they're the ones that can be part of the change. And another thing is that you need to make sustainability a leadership task. It really needs to be people that have to do with sustainability need to have a mandate, and you need to follow through with stuff. So I told you before, we've been IMA certified since 2009. That's very helpful because one part of it is a continuous improvement. And so, yeah, that's the most that's how we approach this, and that's how our green team looks like. We're 12 people. Each of us is heading one of those task forces. They are interdisciplinary and span, we think, all of the areas of the hospital. The first row is like very, very hospital specific. The second one is also like specific to big organization, and the third row is like more general. But like the top row is really the hospital specific part. So even if you're not a hospital, you could just change small parts and maybe adapt that system for you. So that was my input. I hope it was short enough. We had a time constraint, and I thank you for your attention.
Thank you so much, Alexander. It is very inspiring to hear all about the work you do in LKH Villach, but also in your role as the within the Green Hospitals Association, because you're working at both levels, and it's really inspiring to see how it just comes together so incredibly well. So thank you so much for your presentation. Now I would like to invite our second speaker to the floor, Will Clark, who some of you might already know, but just in case you don't, Will Clark is the director of Clark Strategic, a sustainability consultancy specializing in the health and life science sector, and sustainability director with the Geneva Sustainability Center, where he works internationally with healthcare leaders, hospitals, suppliers, NGOs, and policy actors to advance sustainable healthcare system transformation. So, Will, welcome. We are very excited to hear from you today.
Thanks, Diana, and thanks for inviting me along, and thanks for your very generous introduction. Before I dig in, I think I'd just briefly like to introduce the Geneva Sustainability Center, or the GSC, because maybe not everyone's familiar with it. So the GSC is really the sustainability arm of the International Hospitals Federation, the IHF, and it was established just over 3 years ago, really to help healthcare leaders translate sustainability ambition into practical action. And it does that really in a number of ways, but primarily through supporting hospitals through leadership capacity development, but also by providing practical implementation tools, benchmarking, certification, and global peer learning networks. And GSC's goal is really simple. It's to help healthcare organizations become more sustainable, to become more resilient, and ultimately to become future-proof. And I guess through our work with hospitals over the last three years or so, around the world, we've observed 3 key leadership behaviours that we think consistently drive transformation and accelerate progress in sustainable healthcare. And I'll talk you through these briefly in this presentation. So the first point is really that I think successful leaders make sustainability relevant to the organisation's core mission. So rather than positioning it as a sort of an environmental initiative or something that's separate or sits alongside healthcare, it becomes core to the organization's purpose. And a really good example of that is Fundación Santa Fe in Bogotá. So they're a leading 205-bed university hospital in Colombia. They're also, coincidentally, the home organization of the current president of IHF, Dr. Henry Gallardo. And what happened was, after attending one of GSC's executive masterclasses, Dr. Gallardo became convinced that sustainability was a healthcare leadership issue, not just an environmental one. So he decided to make this a strategic priority for his hospital, so embedding it in governance, into decision-making, into the organizational culture. And that leadership really created the conditions for a number of really rapid, impactful initiatives, including one that reduced anesthetic gas emissions by almost 80%. While generating really significant cost savings. So I think the lesson there is really, really simple, that transformation starts when leaders create a shared sense of purpose for their organization. I think the second point is that leadership's not just about setting direction, it's also about removing barriers. So, maybe we'll come on to talk about this, but many staff in hospitals, I think, do want to contribute. Their challenge is often that they're uncertain about where to start and how to prioritize. And whether, in fact, they even have the authority to act, and I think that needs to come from leaders, really. And a great example of this in our network is Mutua Terrassa, which is an integrated healthcare provider in Barcelona, serving Around 1 million people, employs about 5,000 staff. So what happened there is they'd already committed to sustainability, but I guess they recognized that leadership ambition alone wasn't enough. They needed to involve people. So they worked with the GSC to help them translate that ambition into action by developing a really clear framework for staff, practical guidance for staff, and a shared governance approach. And the result was more than 120 new sustainability actions developed and owned by staff across the organisation. And I think the lesson around this is really that leadership, again, isn't just about setting direction, it's about making it easier for people to act and to get involved. And then the last point really here is about collaboration. So, leadership, I guess the key point is leadership evolves over time. So first organizations focus on improving their own activities, on improving themselves, and then they become catalysts for wider change. And this is where things like communities of practice, peer learning, global and regional networks become really powerful. And a great example of that in our network is MP Shah Hospital, which is a leading private hospital in Kenya. They have just over 200 beds. So they're not a huge hospital, but they have a really serious ambition to become a leading sustainability transformation actor in African healthcare. So they had something called the Green 365 strategy, and through that, sustainability has become embedded in the organization's governance and operations and strategy. And that's helped reduce environmental impact while strengthening resilience and performance. But interestingly, they're also one of only now 5 hospitals globally to have achieved the healthcare sustainability certification standard. I think what's interesting really is what happened next. So having transformed their own organisation, they began to look at how they could help advance sustainability more broadly across Kenya and become a hub of best practice in their regions. So we're now working with them, GSC is now working with them to explore what this could look like and how this could feed into the next stage of their sustainability journey. And I think it's a reminder that the most influential leaders don't just create change themselves, they inspire and enable others to act. So I'll just sort of wrap up and try and sort of attempt to draw together some lessons from those examples. I think every hospital context is different. We understand that, but I think the themes I've talked about seem to appear repeatedly across organizations that are making this meaningful progress. Leadership is not just about setting targets, it's not just about launching projects or working alone. It's really about having a clear vision for the future, creating a pathway to action, and importantly, helping others internally and externally to succeed. So I thought I'd close with a challenge, really. So, I'm guessing everyone in the audience here believes in sustainability and believes that sustainability matters for the healthcare sector. I think the leadership challenge, as I said, is really about creating the conditions that allow people and organizations to act and then helping that action spread more widely across the system. So what I'd say is if you're a healthcare leader listening in, instead of asking, why should we act? I think that's understood. I think the question should be about how do we make action easier and how do we help others to move more quickly. So I've rattled through that quite quickly. Thank you very much for listening. If you'd like to dig into any of the themes or case examples in more depth, we can do that in the Q&A, or you're welcome to visit the GSC through any of the links there on the screen. Thanks, Diana. I'll hand back to you.
Thank you so much, Will. Incredible to see all the amazing work you do with the team at the Geneva Sustainability Center. Really interesting, and also the great examples you've given us of amazing leadership practices. So, thank you so much for that. Now I would like to invite our third speaker on screen. Welcome, Ana. Ana Fuster-Munoz is the Environmental Sustainability Manager at Consorcio Hospitalari de Vic. I hope I'm saying that right. And Consorcio de Salud y Social de Catalunya. She has more than 25 years of experience in sustainability, environmental management, consultancy, and CSR. And her work focuses on climate action, on circular economy, sustainable mobility, resource efficiency, and nature-based solutions. She's basically trying to bridge practical implementation with collaborative transformation in healthcare, and she's doing that amazingly well. Hi, Anna. Please, the floor is yours.
Okay, thank you very much. Good afternoon to everybody, and thank you to give us the opportunity to share our experience. My presentation is about 20 years of sustainable healthcare leadership at Consorcio Hospitalario de Vic, or CHV. What I would like to share today is not only a list of environmental projects, but the journey we have followed to move from environmental commitment to more systemic change. For us, leadership in sustainability has meant creating the conditions that allow action to happen, a clear framework, continuity over time, staff involvement, and partnership beyond the hospital itself. So just a few words about who we are. CHV is a local healthcare organization in Catalonia, serving around 170,000 people in a region in the north of Barcelona, Spain. We provide integrated care across hospitals, social care, rehabilitation, and mental health services. This is important because sustainability in our case is not limited to one hospital building. It has to be embedded across different types of services, different centers, and very different professional realities. So that also makes change more complex, but at the same time, it gives us many opportunities to act. Okay, so our environmental journey started in 2000 when CHV approved its first environmental policy. In 2005, we obtained the ISO 14000 and EMA certification, and this has been one of the most important foundations of our work. For me, this is a key leadership lesson. Certifications are not only about external recognition. When they are well integrated, they create continuity, accountability, and a management framework for improvement. Over the years, this framework has allowed us to move from isolated initiatives to more strategic action, water recovery in dialysis, the incorporation of an environmental manager role, which I think is very important, an environmental strategic plan, a sustainable mobility plan, and more recently, we have also joined the Race to Zero commitment, so that we set to be reduce direct emissions by 50% in 2030 and be neutral by 2050. And also this year we joined the Born Green Generation, which is from Healthcare Without Harm. It's a very important project too. So this 20-year journey has given us a structure to act, measure progress, which is very important to measure, and keep sustainability on the organizational agenda. This slide shows you some of concrete examples of how this commitment has translated into action at Hospital Universitari de Vic, which is the biggest hospital we have. For example, now we have 100% renewable electricity and solar photovoltaic panels that generate around 30% of our total energy consumption. We reuse about 25% of the water we consume, mainly through water recovery systems. We have also worked on circular economy, for example, by introducing reusable surgical gowns or other items to reduce plastic use. Other areas include waste valorization, for example, or sustainable mobility, which I will talk a little bit more in next slide. Climate resilience, for example, now we are developing some protocols, specific protocols for heat waves, water scarcity, and floods. And we've also worked in the planetary health field. What is important here is that these are not isolated technical actions. They are the result of a management system that helps identify priorities, define responsibilities, and follow indicators. And especially, they require the involvement of many different teams: infrastructure, for example, logistics, clinical areas, purchasing, waste management, etc. So just taking a little bit a look at the mobility plan, we set this sustainable mobility plan in 2022, and because it was in our strategic plan. But now in Spain, it's mandatory for most of the organizations. Just if you have more than 200 professionals, you have to do this mobility plan. So, but in our case, it was really challenging because of our location, the limited public transport offer that we have, and the low tradition of using collective modes. We have that around 75% of both the staff and visitors arrive in our centers by private vehicle. So this is a good example of a sustainability issue that cannot be solved by the environmental department alone. It requires organizational decisions, collaboration with public authorities, and changes in individual habits as well. So our mobility plan is structured around 4 main action pillars. The first is active mobility. For example, we are introducing new sustainability criteria for allocating parking spaces so that professionals living close to the centers are encouraged to come on foot or by bike. The second is public transport. Here we have less opportunity to act, but we are working with public authorities to improve the offer and exploring the possibilities of a shared shuttle service between organizations in our region. The third is a smarter use of a private vehicle. For example, we have large carbon pooling pilot program, and we have implemented electric vehicle fleet for the home care services. Now with 8 vehicles already implemented, and 4 more that will be introduced by the end of this year. And the fourth is internal mobility management. So we've implemented telework where possible, for example, remote care, and better planning of tests and appointments to avoid unnecessary trips. So for us, the lesson is that leadership is about combining incentives, partnership, and organizational change. So just to summarize what we have learned, I would say that leadership makes systemic change possible through 3 elements. First of all, governance. We need the commitment, and in our case, ISO 14000 and EMAS gave us the opportunity to have a strategic planning structure, continuity, and accountability. Second, people. Real change only happens when clinical teams, technical teams, management teams are involved in daily practice. And third, partnership. Some barriers cannot be solved by one organization alone. We need to work with public authorities, other healthcare organizations, suppliers, and wider networks, like, for example, the HCWH network. But we now focusing on the challenges to engage with the frontline clinical professionals more deeply. So sustainability becomes really part of everyday clinical practice. This is really challenging, but we are in this point now. We are beginning to see this happen. For example, Pediatrics is participating in the Fast Follower project Born Green Generation, as I told you. The surgical area is also progressively incorporating more reusable materials instead of single-use items. And pharmacy is also becoming a growing source of sustainability proposals. So, this is where real transformation happens, when sustainability is no longer an environmental project, but part of how healthcare is delivered. So, to conclude, I would say that sustainable healthcare transformation is not about one project. It is about creating the conditions for many people to act at the same direction. So thank you. I leave you here my email addresses, and I'll be more than pleased to answer any questions. Thank you.
Thank you so much, Anna. It was really impressive. Thank you for showing us also how hospital change works, but also regional change in the sanitary field. So also very interesting initiatives you presented to us, and I'm really happy to go more in depth with that, which brings us to the next part of the session, which is our panel discussion. So I would like to invite back to the stage both Will and Alex. Hi. Welcome back, everyone. So I would like to start this panel discussion by asking Alex, actually, when we're thinking about sustainability initiatives, also especially in your organization, what usually triggers change? Is it more leadership strategy? Is it staff-driven innovation? Is it financial necessity, or is it something else even?
All of them. It depends on the issue. So if it's stuff like things for resilience, how to deal with disasters, etc., like that's definitely a strategy thing. If it's things like, for example, the volatile anesthetics, one of the anesthesiologists of our house pioneered that one. Or if it's kind of like workplace health promotion, like going with the bike, and so things like that. Those come a lot from staff, and of course budgetary restraints was always a thing. So if you can save, like, I don't know, some paper here or there, some I don't know, some plastic stuff, because for example we don't do the for the oxygen, we don't do the I don't know what it's called, the hydration of the oxygen, like it's just plastic bottles filled with sterile water, and in most cases you don't need them, so like you can just not buy them. So that's kind of like a win-win situation. But yeah, it's really, we have the green team. A lot of the decisions come from that. So if you have kind of like an institution like we have, like where it's basically their job to implement stuff and to think about stuff, and they ask the people, the different people in the departments. So yeah, but it's basically it's a mixture. So you have to look at different things. Some of the low-hanging fruits come from our staff, like, and we are really happy that they proposed it, because sometimes you don't even think about it. But yeah, but a lot of it is also strategic. Yeah.
Thank you. Thank you for sharing that with us, and it's really interesting, and we see that more staff-driven initiatives, which is lovely for us to see as well. Also, because we have a lot of our members in the healthcare professional networks at Healthcare.harm Europe as well, so we hear that a lot. Thank you, Alex. And Anna, just to ask you maybe the same question, what is your experience in that? Because you work in a different country, you are working in Spain. Is that also similar there?
Yes, I think yes. As I told in my presentation, I think the very high commitment is very necessary. Then, in our case, having the ISO 14000 and EMAS has given us the structure and the continuity of a continuous improvement management framework. But also now it's very important for us that we have initiatives from bottom up. So we really need to engage people, and I think the clinicians are the ones who really know what they can change and how they can change things in a better way that impacts less. So I think that's the clue.
Thank you. I would like to move to Will now, because you have a lot of experience working with hospitals and also hospital leadership teams. And I think we can all agree sometimes healthcare can be quite complex and often resistant to change. What are the biggest barriers you've encountered, let's say, when trying to support healthcare facilities in advancing sustainability and climate action?
Yeah, it's a great question, isn't it? It's one we all tackle all the time. I mean, I don't think there's a lack of ideas, and I don't think there's a lack of commitment. I think we're seeing that across the sector now. I think hospitals know there are opportunities to reduce emissions, to reduce waste and energy, and that there may even be cost savings attached to that. I think my experience, having worked in the NHS and now working with hospitals around the world and through Healthcare Without Harm, is, hospitals, they're one of the most highly regulated industries. Healthcare, there's competing priorities, lack of resources, all of these themes that can sometimes push sustainability to the margins. It can often feel, I think, for hospital leaders, that it's just another thing on the pile of things to do, and of course that's the last thing that sustainability is. And I think the way to engage leaders is to encourage them or help them see the opportunities. And Anna and Alexander talked about that really articulately. There's so many opportunities around supporting staff health, health and well-being, not just the cost saving, improving patient care, improving care quality. All of these things tie together, and that's the way I think you engage leaders and start to overcome some of those perceived barriers.
Thank you. I was actually also going to ask you about some good or specific tools that these organizations can help to overcome these barriers, but you've already answered some of that. So is there anything you would like to add in terms of tools or specific resources that our audience even...
Yeah, I mean, there's so many, right? I mean, Healthcare Without Harm has got some really great tools. I think, Anna made this point, networking. So just being part of events like this, sharing best practice, figuring out what works collectively, all of these things are things that you can take back into your hospitals to present the case for sustainability. So I'd say that collaboration piece is key. I mean, the Geneva Sustainability Centre has some great tools. They have the Sustainability Accelerator tool, SAT, which helps hospitals to benchmark and to build roadmaps for change. There's a thing called CEL, the Carbon Emissions Learning Lab, which is it's like a simulator for healthcare leaders to model different ways of reducing emissions and look at the trade-offs, and it's quite an interactive thing. So there are lots of things out there, but I'd say the key thing is networking and building and attending events like this. I think is so important.
Absolutely. Thank you. And because you also mentioned Anna, actually, my next follow-up question is to you, Anna. What are some tools for you that helped you in your role in a leadership team in advancing this also at the local level, but also at the regional level?
Yes, and yes, as I totally agree with Will, because in our case, as I am in the Consorci de Salut i Social de Catalunya, which is like an association of hospitals from Catalonia, there we also created the Green Team. We call it like that, and we started at the end of 2024 with 12 healthcare facilities, and now we are 22. So I think this is a great place where we have developed a roadmap for the rest of the members, and now we agreed in KPIs, and we will start benchmarking. So I think this is going to be very helpful for us in a regional level. In Spain, we are also part of the ECODES, which is another national organization, and I think that's very important too. And in the European level, obviously, be part of the HCWH network. So I think this is the key, because we all have same problems, same challenges, same barriers, and so we just need to share and work together. Definitely.
Thank you. That's very valuable coming from both you and Will, and I think it helps also me, but especially also our audience, in maybe brainstorming a bit different ways that they could also make use of all of the initiatives around them. So thank you for that. Alex, I'm coming back to you. So small sustainability initiatives, but sometimes scaling them across organization or even across more organizations, like as you are part of the Green Hospitals Association in Austria, is a bit harder. So what role does leadership play in turning smaller, isolated projects and initiatives into long-term organizational change?
Well, I think within the organization, you have to create leadership, not create leadership, you have to create ownership. So people need to think and need to feel that it's like they also want it, like you can't push things through without the support of your employees. Like they are just gonna do whatever they want anyway. I always say hospital is an expert organization. Everybody's an expert, so try telling them what to do. And so they really need to feel it, and they need to own it. And I think that's the most important thing within, between organizations. What's very important is, I think, to just share best practices, show your results, show your lessons learned. What we are also doing in Austria is we are trying to connect specialists with each other. So, like for example, the technical leads of the hospital, all of them have a online opportunity to talk to each other, to present best practices, because sometimes that can be better than if you hear something at a conference like here, like the director comes, hears something at the conference, goes home, like a great project, goes home, goes to his technical department head, and he says, "Nah, that's not going to work with us." But if the guy talks to another technician, the other technician is going to say, for example, "Yeah, we had the same problem, but we did this, and this, and then it's going to work." So that's one of the things that I think are important. But networking, exchanging experiences, lessons learned. If something doesn't work out, tell them. Like we had, for example, for mobility, we tried using an app. Didn't work out. People didn't use it. So we decided now is not the right moment. We're going to try it again at a later time. We're still doing a lot of stuff in that area, but the app just didn't catch on. So yeah.
All right. Thank you so much. It's really interesting, your point about ownership, because it just made me think about all of the stuff that sometimes feels isolated in this. And I guess sustainability also belongs to them. So I think that's also really important to make as a case that it's up to all of us, but we all can also do our part in it. So thank you so much for that. And maybe just my last small question, just a follow up to Will about this, and then we can move into the chat to see the questions from the attendees. What are your experiences with scaling up, Will? Because you work with hospitals also in European countries, but also internationally now with the Geneva Sustainability Center.
Yeah, I mean, it all comes back to leadership. You need that permission to change and to move forward, I think. And that's how things scale. I mean, I think the other, just reflecting on what Alex was saying, I think the other point is about culture. I think the organizations that are really leading in this, and I'm sure Anna and Alexander recognize this, they're building this into their cultures, right? So you may have a visionary leader that says, I talked about, Dr. Gallardo, he said in his hospital, we're going to do this, we're going to make this a priority, and that's great. But if he leaves, or she leaves, or the leader leaves, then what happens? And so that's why I think it's really important that this sustainability becomes interwoven into the way that the organization functions. It becomes seen as synonymous with great patient care, and that it becomes part of the culture. And it's the way we do business in this hospital, and that way it has longevity, and that gives you a good platform for scaling some of these things. So I think that's the other reflection I would add.
Thank you so much. This was all really excellent, and we even have even more excellent questions in the chat. We're probably not going to be able to take all of them, but I'll do my best to address some. We have one question for Anna. Did we hear something about nature-based solutions at your hospital, perhaps included in your climate resilient actions?
Well, no. In fact, we are in an European project called Teresa PCP, and we hope this project will give us some solutions for the water charge that we have, to take away substances that I think there are no ways to take them away right now. So that's why it's an innovative project, and I think it has to be solved with nature-based solutions. That's what we think. But I hope we can tell you a little bit more about this in a few years. It's not an easy project. It's a long-term project. Mm-hmm.
Thank you. We're excited to hear more about it then. Now a question for Will. Do you have any comments about how to approach leadership of publicly owned versus privately owned hospitals?
Oh, God. Good question. How long have we got? I mean, I think a lot. I'll try and be brief. I mean, I think a lot of the points are kind of the same in terms of the opportunities. I think public hospitals tend to be more aware or more driven, more affected by policy. Public policy, maybe public health um, concerns, and have that more of that kind of flavour. Whereas private hospitals perhaps are more operational. They're more driven by the business case, possibly. It's more of a risk management issue. So I think you just have to. I think wherever you're working, you just got to make the case that this is about core business. It supports great patient care, and just find the hooks. Like every organization will have a hook that you can attach sustainability to, whatever that looks like. So I'm sorry, I probably didn't do a very good job of answering the question, but maybe I'll put some more thoughts in the chat.
Yeah, we also invite David to also approach you privately and perhaps discuss the question further. Thank you. We have a question for Alexander regarding the planetary diet. So what have been the main benefits of adopting a planetary diet in your hospital? Did you encounter any challenges in increasing the amount of plant-based meals?
I'll start with the challenges. So just so you know, like we've been, like the planetary health diet was published in 2023. And we've been struggling since then. Like even before, we wanted to have more vegetarian days in our hospital, but there's been, I don't know, years of problems, and nobody wanted it. And even if us in the Green Team came, no, that you can't do that, and people need to have the freedom to eat meat if they want. But yeah, so in the end, we decided, and I got into a meeting with this, like such a pack of advantages of the planetary health diet and why we should do it. And then I got into the meeting, and suddenly, like before I could even say anything, everybody said, "Yeah, why don't we do this?" And then we just did it. So like sometimes it's just like, even if it's like 2 years of no, just keep going, and when the time is right, it's gonna work. But that was a challenge, and then once we decided it was not a democratic decision; it was a top-down decision. Like we didn't ask the hospitals. Like sometimes some decisions are democratic, some are not. We didn't ask the hospital staff, and we got basically now in retrospect, usually the vegetarian dish we have is the one that's got the best marks when we do you can every day you go to the canteen, you can choose like how happy you are, which meal you had, how did you enjoy it, and the vegetarian one is usually the best rated. And so that's one thing. On the other hand, we of course had to, we had, I don't know, I think it was a surgeon or something, and he said how do you expect me to have 24 hours of energy just on a carrot cake or something like that? So sometimes you get something like this. The patients, I think, we are giving out awareness stuff on the patient on the trays, but if they don't read it, I don't even know that if they would even notice it. If we didn't do it, I don't think they would even notice it, because it's most of them are here 3-4 days. We're an acute care hospital, so if there's one day no meat, and then there's meat, and then there's again something else nice without meat, you won't even notice that it's missing, I think. So that's the thing. What we are doing for the employees is a lot of awareness stuff. We also have cooking classes, which is also good for team building and for new international employees here from Kenya. I attended a cooking class where I learned how to make Kenyan biryani and stuff like that. So yeah, so stuff like that. So those were the challenges, and the advantages. Obviously, it's health prevention. It's prevention. So I can't say that our employees are healthier now, but I don't know. Maybe they would have become unhealthy if they continued eating meat every day for 20 years. But it's not a little bit of money, you save a little bit of money, but we're trying to put that money into higher quality plant-based proteins. So we are doing more organic stuff, because actually in Austria, the funny thing is, the government wants us to use organic stuff, but we don't get the money. So but there was almost no resistance. Like, there was a few people complaining, and maybe you noticed that maybe on days where it's only vegetarian food, is like, I don't know, 20 people less go there, and maybe they order pizza or whatever. But it's not like, basically it just went through very smoothly, and shows sometimes top down can work.
Absolutely. Well, thank you so much. That was extremely interesting. Unfortunately, we have come to the end of this great session. There's so many more amazing questions in the chat, which I would love to be able to address. Unfortunately, we don't not have time in this session, but feel free to message our speakers individually. Thank you, all three of you, immensely for today's participation. It was extremely insightful, really, really great presentations and really great practices that you've presented us today. We have come to the end of the session, as I said. Once again, thank you all of the attendees as well. I would like to introduce you to the next sessions. So we have coming up next, how circular healthcare is transforming health for people, the planet, and your budget, which will begin at 17:30 CEST. I would also like to highlight other sessions we have coming up tomorrow at 12:30 CEST. We'll have Can Cancer Treatment Be Sustainable? Green Practices in Non-Communicable Diseases. And at 17:15 CST, we'll have Championing Sustainability in Healthcare, announcing our European Sustainable Healthcare Awards winners, which is going to be a really interesting session, as well as a great workshop, Delivering Climate Commitments through Sustainable Healthcare Practices, which begins at 16:30 CST. And it can be accessed through the workshop tab, so be sure to click there. So many thanks to all of you for joining, and enjoy the conference.